Full Circle Orthopedics, providing you exceptional care with the right diagnosis since 1983.
Led by Dr. Robert Donnelly.
Hi, this is Dr. Donnelly. Thought we'd talk a little about stretching today. While the science is still out on stretching, a lot of people, a lot of athletes find it's very helpful. It's part of general flexibility and a great warm-up for a lot of athletic events. There are a lot of stretches, and I want to talk about some of the better ones today. Stretching the hamstrings and quadriceps is thought to be quite important. These are muscles that cross two joints. Because they cross two joints, they tend to get tight. So hamstring and quadricep flexibility are important. Also, for patients with kneecap problems, stretching the hamstrings and quadriceps tends to be very helpful. One common stretch you're probably familiar with is called a hurdler stretch. You do it lying down, and by bending forward on your straight leg, you can stretch the hamstring, and bending back stretches both the quadricep and hip flexor. It's a good exercise, but it involves a lot of strain on the low back. So a better stretch for hamstrings is demonstrated here. You can put your involved leg up on a table or a chair and then bend forward. And you want to stretch to the point you feel tension but not pain. This is a good hamstring stretch. A good quadricep stretch is shown here. Grab your foot with your hand and pull back. You can stretch both your quadricep and your hip flexor. And this is easy. Most people can do it. Some people need a towel or a band to help reach their foot. Moving on, the muscles of the calf involve the gastrocnemius soleus and the often called the triceps surae. So calf stretches are very important. Again, you've got a muscle that crosses two joints. You do this by putting your foot flat on the floor, lean forward, and gradually straighten your knee till you can feel the tension on the calf muscle. Again, stretch till you feel tension but not pain. An interesting fact, I think everybody knows this stretch, but if you turn your foot in a little bit, it works better to stretch the calf and take some of the stress off the joints of the foot. Next, internal rotation of the shoulders is very important, especially for throwing athletes. It helps control a lot of the tightness that develops in the posterior capsule, helps stop impingement, internal impingement, this sort of thing. Do this with the shoulder horn. Get this on Amazon. We've got a separate video on. And just hold the weights and let the dumbbells stretch the arms down, stretch that posterior capsule. This is a very good stretch for throwers and people with shoulder problems. Finally, we've got gravity all day pulling us down, and we want to stand up nice and straight. To help stretch the anterior longitudinal ligament, a lot of the structures of the front of the spine as well as the shoulders. This is a great stretch. Lie down, put your back, then stretch your arms up over your head nice and high. Get the shoulders all the way straight. Current thing is that you should hold stretches for about 30 seconds to a minute. And you get most benefit if you do it consistently for several weeks or several months. That's it for today. Happy stretching.
I have to say I am whole again because of Dr. Donnelly. He has changed my life.
Probably one of the best doctors I've ever been to.
He took care of my knee when no one else could find something wrong with it after a fall.